And I'll throw out a question, which is, what does it mean today when patients anywhere in the world can get to their computer and they can see all of this research that's happening, and they look themselves and wonder, well, if I live there, I could maybe get this treatment. Can we talk a little bit about, perhaps Kathy, what does this mean? And there's a psychosocial impact to that as well as a physical clinical impact.
Yes, my name is Kathy Oliver. I'm a co-director of the International Brain Tumor Alliance. I believe that the internet is a very, very useful tool for patients who have cancer, particularly those who have a rare cancer, because it's very difficult when you're in the rare cancer community, and I represent brain tumors, to find information which is not readily available through normal channels. And I think that one of the problems we have as patients is that sometimes the internet is condemned wholesale as being an irresponsible and even dangerous place for patients to go to. However, there are some excellent websites up there. I think we need to support those websites and convince people that there is a great value to the internet. In the rare cancer community, we have a very bad shortage of information, of support, and very often that's the only place that patients can go to for support if they have a rare cancer. They will find like-minded people going through similar challenges. And so even though sometimes the internet can be a dangerous place, we have to look beyond that and realize that it does bring value to particular communities.
One of the issues that I deal with is the difficulty that many patients have in searching out information, in identifying charlatan practices. And often the conflation between, or confusion between, what offers a real source of hope and what really is a bogus treatment, often which cynically exploits very vulnerable patients, is a very difficult challenge. Unfortunately, the clinician is often looked at as someone with a vested interest and is not seen as a credible resource for evaluating the merit of a non-conventional therapy. And I think that the patient advocacy groups really have a potentially very important role to help skill people in identifying and being able to sort through what really offers something which is real hope and what is bogus, misleading, and manipulative. So this is a challenge that I'd sort of like to put on the table, because I think that it's really not been very well addressed by the patient advocacy groups to date.
And it's a bigger challenge exactly because of the internet and being able to get all of this. Yes, hype.
There is such profound, when people get onto the internet, there's such profound confusion between what is real and really what is illusory and manipulative.